Part 1. What do we know? This part deals with some concepts we usually apply when speaking about health and diseases. Here they are illuminated in a more holistic perspective. Mostly we live on the automatic pilot, using phrases and expressions without having a clear remembrance of the origin of or the depth of the words. Our choice of words and concepts are neither random nor insignificant, and they may limit us as well as open our eyes to new perspectives on life and ourselves. Thus, this first part is essential for understanding this holistic approach in healing. Evidence. Evidence can be described as some observations that are used in order to support a theory. The widely applied form of evidence in medical science are observations of a group of people's personal experiences, where the common features of interests are determined by the researcher. The researcher makes a conclusion which we tend to believe is truer than something else, by emphasizing that it is evidence-based. These conclusions refer to observations from a selected group of people at a specific time in their lives, where the researcher chooses the focus of interest. If the focus is on lack, that is what is sought and found. If the focus is on well-being, that is what is sought and found. What is sought and found depends on the focus of the researcher. In order to say that a given study is true for someone else than the people in the study, that research must be repeated in other human beings. So if we are curiously investigating medical evidence, how many studies are reproduced under exactly the same experimental circumstances in order to say that the results of the study also concern someone else? The answer is none. It is impossible to make two identical human studies. The circumstances will always be new. A new day, new surroundings, new eyes. Nothing remains the same, neither the conditions nor the examined person. And to definitely prove that something is truth, we also need to prove it the other way around. For example, if someone gets cured by a treatment, we must prove that they will not get cured without this treatment or with any other treatment. This is not possible to prove, since a person cannot participate in two studies at the same time. Remember that every hour and every day we get new inputs and make new discoveries, and it all affects us and the healing process in ways the researcher and the test persons are unaware of. So it is with rather little knowledge that we sometimes express ourselves with great certainty by saying, "It is proven." Evidence-based studies are not proofs. The proof is in every living individual, and the final result is at the end of life. In some way it is like the story of Santa Claus, who delivers Christmas presents through the chimney. As a child, not knowing how life works, we believe the stories we are told, until we know better through our own life experiences. Evidence is often used to emphasize statements as if it is a fact. However, if the assumptions are changed, so is the evidence. It is an assumption in evidence-based medicine that studies made on a group of people can be applied on an individual. Although we all have organs that look somehow alike, our well-being right down to each unique organ depends on our life situation at a given time in our life. Each of the persons who participated in the research have their own individual story, and their life situations have changed since the research took place. Thus, their individual well-being has also changed. Researches are a snapshot which describes some similar symptoms in a group of people observed at a given time in their life. It does not describe why the symptoms appear in the individual. The researcher may have some assumptions, and we may have some glimpses of understanding as to why symptoms appear and disappear. However, we may never get the full understanding. If we remember how complicated the body-mind is, with estimated 37 billion chemical reactions per second and 300 million cell turnover per minute and 60,000 different thoughts through a day, we may understand how little we know about the causes and the occurrence of changes, diseases, and healing. The human mind tends to simplify this complexity into a single cause and effect relation, and focus on that in forgetting the millions of other factors of inputs a human being is exposed to 24 hours a day, which altogether result in reactions in the human body. In fact, if we explore into researches, most of them are correlations, or, put in another way, assumptions. Further, if we remember how the brain is connected with the body through the thalamus-hypothalamus-adrenic axis, we may understand that sensations associated with thoughts have an impact on our physical body. It is obvious in conditions such as stress and depression, where the person is suffering from psychological as well as physical symptoms at the same time. There are just as many ways to well-being and healing as there are human beings in the world. By referring entirely to researches, we may let go of looking for the answers within ourselves. We are able to feel what is good and what is less than good in our body, and we can learn it again if we forget it in our efforts to find the answers outside ourselves, whether in the evidence or elsewhere. There is a story before the symptom shows up. The body simply responds with a symptom in order to direct our attention towards something we are invited to look at. It is a possibility to make new choices and live in greater peace and freedom with ourselves, with or without the original symptom. Rarely someone has been putting something into our body without us being aware of it or accepting it. We have a possibility to choose more consciously once we know better and are able to act differently. To understand our bodily symptoms as messengers requires a change in our conventional way of thinking. It's a bit like turning the pyramid upside down, in the sense that it is not the evidence, the doctor, or the test result that knows how we feel and what we truly need. However, we may still need a doctor or another person to help us to understand and relate to our symptoms, our habits, thoughts and emotions as they appear in the body. At the same time, we can work on the way we relate to ourselves and the surroundings. How may evidence then be used? It may bring some peace when we get ill and anxious, if we know that there are others who feel something alike. Also, the belief in there's someone who knows and takes care brings peace, which is healing for a while. It may be scary to know that a doctor as well as no one else know the complete truth about our healing way, although it might be relieving to lean on others for a while. The help from without is most of all about care and being seen and embraced as a unique human being. This is difficult to fulfill unless we become one with another human being. So we all do our best with the awareness and abilities we have at a given time. On our healing way, we must let go of the belief that our health can be fully controlled and accept all that we do not know. Also, we may discover peace and safety within by recognizing our true nature. Evidence could be used like this in a present situation. When a man suffers from a sore back, it's good to have in mind from past experiences that there are some rare symptoms that may require immediate action. To uncover this, the doctor unconsciously uses evidence. Treating the man's back pain according to past experiences about what might happen may bring more harm than healing. It is like feeding and treating the fear. Ameliorating the symptom may be necessary and of great relief. However, it does not remove the cause of the symptom. The doctor can explore behind the evidence and look behind the present symptoms and ask about the man's life situations, such as his work, economy, trauma, housing, family and relationships, some of the many factors that also influence the body. The doctor cannot treat these circumstances and may feel just as powerless as the man. In the powerlessness, the doctor and the man may try to treat the symptoms, and in a sense they are dancing around the cause of the symptoms, which is about the way the man is relating to his life experiences. Although it may be helpful to treat the physiological changes in the body, it is rarely enough. It is just as necessary to clarify the cause for suffering. Otherwise, the man will return, eventually with new symptoms. Furthermore, most patients no longer want to be patients in the sense of waiting patiently, which puts additional pressure on the doctor to quickly offer a solution, such as medication. Patience is an important ingredient in healing. Meanwhile, we may become aware of our way of living if we are stressed and abusing ourselves in some way. This cannot be treated with medication, although a treatment may soothe for a while. Other people's past experiences, also in the form of evidence, can provide some knowledge and help us to ask questions in a present situation. It may also distract us so that we lose focus on ourselves in the present situation, where the key to true well-being is hidden. Simply basing our decisions on other people's past experiences and following guidelines based on them can lead to an anxiety-based, time-consuming, costly behavior that distances us from ourselves and life here and now.